So let's talk about physical therapy after knee replacement. You know, if you look at my hip replacement patients and my knee replacement patients, the knee replacement patients are going to have a tougher time. It is a little bit tougher recovery for a knee replacement, and therapy is much more important with a knee replacement in regards to the amount of work that you put into this is the amount that you'll get out of it. We all want to obviously be pain-free, and that's a low goal with a knee replacement. You're going to get there. I can step over that goal pretty easily. In terms of being satisfied with your knee replacement, range of motion goes into that, stability goes into that, and we know that the harder you work with physical therapy after your replacement, the more you're going to get out of it. Knee replacement, we want to get a 0 to 120 or 130 degree bend, and if you don't get 0, you're not going to stand up straight. And if you don't bend back to 120, you can't sit on these small airplane seats we have now or on the bus. And so we want you to work really hard in the first 3 months to get that range of motion, because those first 3 months set the stage for the rest of your life. And so I tell patients that you're going to work really hard with therapy these first 3 months so that you're happy with my knee replacement for the rest of your life. Therapy has to be done with proper pain control, and it's important to communicate with your doctor that your pain is not controlled, because if you don't have your pain controlled, the therapist can't push you harder, or you can't push yourself harder. So for me, I like to keep in constant communication with my patients. I want you to call me and tell me that things aren't going the way they should be going or the way I feel they're going. I do a bunch of these. I know what to expect. You're at home by yourself, scared to death that this is not what's supposed to be happening, and we want you to talk to us and let us know how things are going.